Hello everyone, my name is Maria Flores and today I'll be discussing childhood vaccination requirements as an ethical dilemma in public health. This topic sits at the intersection of healthcare, law, ethics, and social responsibility. It also continues to generate debate amongst parents, providers, policymakers, and communities. Vaccinations are widely recognized as one of the most effective public health interventions in history, yet they remain controversial because they raise difficult questions about individual liberty, paternal authority, and the role of government in protecting population health. These tensions become especially visible during the COVID-19 pandemic, but they have existed long before that, particularly in the context of childhood immunization requirements for school entry. Okay, so here is the overview of the presentation. I'll kick us off with an introduction where I frame childhood vaccination not just as a medical issue, but as an ethical dilemma that affects families, healthcare professionals, and public health systems. I'll then discuss the major concepts and controversies, including herd immunity, risk versus benefit, parental authority, and trust in healthcare. Really, these ideas just help explain why vaccination can be such an emotional and complex decision for many parents. After that, I'll touch on ethical theories and principles such as beneficence, non-maleficence, autonomy, justice, and social justice, and how they guide professional practice and public health policy when clearly there just isn't one answer or an easy answer. And then I'll shift to the legal framework, right? We want to understand that the legality and standard of care, focusing on why it's important for healthcare professionals to understand vaccination laws, liability, informed consent, and documentation responsibilities. I'll walk us through those moral arguments and policy positions. Really, I was just outlining both sides of the vaccination debate and how public health policy attempts to balance individual rights with community protection. And then finally, I'll close this out by explaining how biblical values inform my ethical framework in healthcare while respecting that not everyone shares the same beliefs I do, but still maintaining that level of respect in their beliefs. Overall, my goal is to show how ethics, law, public health, and personal values intersect in real-world healthcare decisions. I can honestly relate, as this was one that I had to personally face when I was making a choice as a first-time mom. So we have the whys and what of vaccination in children. So why are children vaccinations still ethically contested? Well, there are still many whys and whats when it comes to those vaccination concerns that we have for children, because even though vaccines are strongly supported by scientific evidence, they continue to raise ethical questions because they involve balancing personal choice with responsibility to others. For many parents like myself, the concern is not about rejecting science, but about trust, fear of unintended harm, and wanting to make the best possible decision for our children. This ongoing balance between individual autonomy and protecting public health is why childhood vaccination remains ethically contested. Another question is, why does this dilemma matter now? Well, it matters because more than ever, we're seeing the real effects of lower vaccination rates, outbreaks of vaccine-preventable diseases, and the lasting influence of the COVID-19 pandemic have increased confusion, fear, and disagreement around vaccines. At the same time, though, healthcare professionals are having more difficult conversations with family who have questions or concerns, making it important to return to the ethical foundations behind vaccination policies rather than relying on rules alone. And then you might be asking, well, who's at stake? What's at stake for parents, families, and communities? What's at stake goes beyond individual decisions. These are for patients, delayed or refused vaccinations, increase the risk of serious illnesses and long-term complication. For families, these choices can bring stress and uncertainty, especially when they affect school attendance or access to care. At the community level, lower vaccination coverage weakens herd immunity, placing vulnerable populations such as infants and immunocompromised individuals at greater risk. The ethical challenge is finding a way to protect both public health while still respecting personal values and maintaining trust within the community. One of the key ideas behind childhood vaccination is herd immunity. The Cleveland Clinic defines herd immunity as when enough people in an area have immunity to a disease that it no longer spreads easily, which usually requires a large number of people to be vaccinated or previously exposed. This image here from Johns Hopkins helps visualize this concept. On the left, when herd immunity is not present, disease spreads easily through a community. On the right, when enough people are immune, the spread slows or it even stops. Now, vaccinations help the immune system recognize and fight diseases, and when vaccination rates are high, the spread of illnesses is limited. This protection doesn't just benefit the individual child who receives the vaccine, it also helps protect vulnerable individuals like infants or people with weakened immune systems and supports the overall health of the community. For me, this became very real when I thought about my child being around other babies at daycare or school, knowing that some children rely on the rest of us to be vaccinated for their safety. In that sense, vaccination becomes more than a personal choice. To me, it's more of a reflection of a shared responsibility to protect one another. Another major controversy around childhood vaccination is the risk-benefit trade-off. Babies and children are exposed to thousands of germs every day through the air they breathe, the food they eat, and the things they touch. While babies are born with immune systems that can handle many germs, some diseases are simply too serious or dangerous for children's bodies to fight on its own. According to the CDC, vaccines use very small amounts of antigens to safely teach the immune system how to recognize and fight these serious diseases. Like any medication, vaccines can cause side effects, but most reactions are mild and temporary. Serious adverse effects are extremely rare from a public health perspective. Vaccination is widely viewed as a safer option compared to these risks associated with vaccine preventable diseases. Another major concept is the parental authority in child welfare. Parental authority plays a central role in childhood vaccination decisions. Parents are responsible for protecting their children and making healthcare choices on their behalf. Many parents who question vaccines are not opposed to protecting their child, but they just want to understand, right? What's exactly given to them and why. These concerns about vaccine ingredients often come up in these conversations. According to the CDC, today's vaccines contain only what is needed to be safe and effective, and these ingredients are used in very small amounts and are often found naturally in the body or in everyday products. Where the ethical challenge arises is when parental decisions may increase a child's risk of serious illness or impact the safety of others. This raises questions about when public health intervention becomes appropriate. This is also where schools get involved, and a lot of the school systems you'll see will require this from their parents, that a list of vaccinations and that they're up to date is given to them during the admissions process. Under the subject of major concepts and controversy comes misinformation, trust, and historical harms. Trust is another major factor in vaccination controversies. Many parents encounter claims online or through social media that vaccines are harmful when they're not properly tested, which can understandably create fear and confusion. In fact, research from the Pew Research Center shows that about 70% of U.S. adults report seeing false or misleading information about vaccines, and repeated exposure to this kind of information has been linked to lower trust in both vaccines and healthcare providers. But in reality, these vaccines undergo years of extensive laboratory testing and large clinical trials, often involving tens of thousands of participants before they're approved for use. Even when they are approved, vaccines continue to be closely monitored by agencies like the CDC and FDA. These are through multiple safety monitoring systems. Serious long-term side effects are extremely rare, but they often have rates of less than 1 per million doses for most vaccines. However, at that same time, it is important to recognize that misinformation is not only a factor of affecting affecting trust, but past medical injustices and unethical research practices have had lasting effects, particularly in marginalized communities, and continue to shape how healthcare systems are viewed today. Because of this history, ethical practices requires more than just simple presenting facts. Healthcare professionals have a responsibility to approach vaccine conversations with transparency, empathy, and respect. Understanding that trust is built through honest communication and listening rather than being dismissive. Lastly, we'll be talking about equity as one of the major concepts and controversies. So who bears the burden when coverage is low? Equity is a critical consideration in childhood vaccination and is often overlooked in these discussions. When vaccination rates decline, the burden of these diseases do not fall equally across all populations. Infants, children with underlying medical conditions, and families with limited access to health care are often the most affected by these outbreaks of vaccine-prevented diseases. Now, from a social justice perspective, as described in our textbook, it references it to the fair distribution of wealth, opportunities, and privileges within a society. These vaccination coverage become low. Those who are already facing these barriers in healthcare, transportation, insurance, or reliable medical information are most likely to experience negative outcomes. This means that the consequences of lower vaccination rates are not shared equally. Even though the risks are created at a community level, they are not equal. Vaccination also helps protect not only individual children, but also the broader community, especially those who rely on those herd communities that we were talking about earlier for protection. They cannot be vaccinated for medical reasons. Now, from an ethical standpoint, equitable public health policy must consider who is most vulnerable when coverage is low and ensure that prevention efforts do not unintentionally place a greater burden on already marginalized families. And now we're going to move in the presentation about the ethical theories. I wanted just to give a quick overview of what to expect in this section. I'll start by talking through some of those core ethical principles like beneficence, non-maleficence, autonomy, and justice, and how they relate to childhood vaccination decisions. Then I'll walk us through a few ethical theories, including utilitarianism, deontological ethics, and communitarian ethics, to explain how public health policies around vaccinations are evaluated. Finally, I'll tie it all together using a social justice perspective, focusing on how these policies impact vulnerable populations and why equity matters in ethical decision making. When we talk about childhood vaccination from an ethical standpoint, several core principles guide decision making. Our textbook talks about different principles such as beneficence. So we'll talk first about how it refers to acting in ways that promote good and prevent harm. Vaccines clearly align with this principle because they prevent serious illness, complications, and even death. Closely related is the non-maleficence, the duty to do no harm. While vaccinations may still have mild side effects, failing to vaccinate increases the risk of outbreaks and serious diseases, which can cause for far greater harm. From this perspective, preventing avoidable diseases and illnesses through vaccination supports the ethical obligation to minimize harm. Lastly, autonomy. Autonomy is also central to this discussion. Parents generally have the right to make healthcare decisions for their children. However, autonomy is not absolute, especially when individual choices have the potential to harm others. In this case, that decision could affect the community safety. These ethical limits on personal choice may be justified, but not strongly encouraged. So we went over a little bit about those principles, ethical principles in childhood vaccination. Now we'll talk a little bit more about the theories applied to vaccination policy. There are different ethical theories that can help us explain why vaccination policies exist. We'll take, for example, utilitarianism, which focuses on maximizing overall well-being. From this perspective, high vaccination coverage is ethically supported because it produces the greatest benefit for the largest number of people by reducing diseases, hospitalization, and deaths. Deontology, as explained in our book, this is more duty-based. This is emphasizing moral obligations rather than outcomes. And in this framework, there is a duty to protect children from harm and to prevent actions that could endanger others. Vaccination aligns with this duty by reducing the risk of transmitting preventable diseases, and then lastly, communitarian ethics. This is that shared responsibility through health, right? This is where we prioritize the health of the community as a whole. This approach emphasizes shared responsibility and mutual protection, recognizing that public health depends on collective participation rather than purely individual decision making. I think this is where I think most about my children, keeping others safe around my children, and expecting the same thing from a community view, that others as well will vaccinate their children, so that my children will not get sick. And so it's kind of like that trust amongst that community. So we did touch on this earlier during the equity section about social justice and ethical responsibility, but I'm bringing it up again because I believe that social justice is not just a public health concern, it's also a core ethical responsibility. When we apply ethical theories to vaccination policy, social justice helps us evaluate who benefits, who is protected, and who may be unintentionally harmed by the way policies are designated or implemented. Low vaccination rates do not impact all population equally. Infants are immunocompromised children, and communities with limited access to healthcare are often the most affected by outbreaks of vaccine-preventable diseases. These populations are more likely to face barriers such as transportation challenges, cost concerns, limited provider access, or lack of reliable health information. Now, from a social justice perspective, as I mentioned earlier, it's an ethical policy that must focus on the fair distribution of protection and burdens. That's why I use the same illustration of equity. This means avoiding approaches that punish marginalized families and instead prioritizes the policies that reduce barriers and expand access. Ethical vaccination policies should aim to protect the most vulnerable while promoting fairness and equity across communities. Up to this point, I've talked a lot about ethics, principles, public health values, but for healthcare professionals, those values are practiced within a legal framework. The law plays a crucial role in how vaccination decisions are handled in a real clinic setting. Understanding the legal framework is important because it guides what providers are expected to do, how care is evaluated, and what happens when those expectations are not met. And we'll go over that through standard of care. Healthcare professionals operate within legal rules that directly shape how care is delivered. Laws guide professional responsibilities, including what providers are expected to recommend and how they're expected to practice. Our textbook definitely talks about these legal standards, what they define, what is considered appropriate care, especially in areas like childhood vaccination where evidence-based guidelines already exist. When providers do not meet these expectations, failure to comply can create liability, particularly if something goes wrong. From my perspective, understanding this legal framework has helped me realize that vaccination conversations are not optional or based on my personal comfort. Even when discussions may feel uncomfortable for me or emotionally charged, the law experts providers are to act in alignment with established medical standards. As someone who has had to think through these decisions both professionally and as a parent, this only reinforces that ethical intentions alone are not enough. The legal responsibility plays a crucial role in protecting patients, maintaining trust, and holding healthcare professionals accountable. I understand that legal framework helps explain the boundaries and responsibilities healthcare professionals work within, but those expectations come from more concrete talks about standard of care. So we'll talk a little bit about what that standard of care should look like and how the standard of care is translated into law with those responsibilities into everyday clinical practice, especially when it comes to childhood vaccination. So throughout our textbook, we are reminded of standard of care, and it refers to what a reasonably competent healthcare professional would do under similar circumstances. It represents the baseline expectation for safe, ethical, and legal sound practices. So when it comes to childhood vaccination, the standard of care includes following evidence-based immunization schedules. These are established through milestones in a child's growth patterns, and it is established through clinical guidelines. These schedules are developed through years of research and are designed to protect children at the ages when they're most vulnerable to serious diseases. Providers are expected to stay current with these guidelines and apply them consistently in practice. The CDCE also recommends that the standard of care requires screening for contraindications before administering vaccines. This means reviewing a child's medical history, asking appropriate questions, and making sure vaccination is safe for that individual patient. This step is very important because it shows how care is thoughtful and individualized rather than automatic. Another essential part of standard of care is clear communication and documentation, particularly when parents have questions or choose to delay or decline vaccination. Providers are expected to clearly recommend vaccines, explain the risks and benefits, and document those discussions thoroughly. When a parent refuses vaccination, documenting informed refusal is not optional. The CDC says that this is the critical part of meeting legal and professional obligations. But from my perspective, this is where theory turns into real practice. When I make a different choice, it's the provider's responsibility to ensure that the conversation was respectful, informative, and clear so that I could understand what it is that I'm putting into my child's body when it comes to vaccination. Good documentation demonstrates that the provider followed evidence-based guidance and acted in the best interest of the child. A provider may face liability if they fail to recommend vaccines, do not screen for contraindications, or neglect to document informal refusal. Understanding the standard of care helps healthcare professionals navigate through these situations with clarity and confidence, reinforcing that consistent practice, communication, and documentation are essential to protecting patients, families, and providers alike. So after understanding the standard of care, especially how it's been showed to us in our textbook, it's also important to look at what happens when the standard is not met, which brings us to torts and professional liability, which was also discussed in our book, where healthcare professionals may face legal liability under tort law. Particularly negligence. This is where actions or omissions fall below what is considered acceptable and reasonable care. This area of law is especially relevant in childhood vaccination because the consequences of missteps can affect not just one patient, again, but families and communities as well. This is where we were talking about herd immunity and, the vaccination practice. Negligence can take several forms. It may involve failing to recommend vaccines according to established evidence-based guidelines, not screening for contraindications, or not adequately counseling parents about the risks and benefits of vaccination. In some cases, liability does not arise from what a provider did, but from what they have not done. So this is where there's poor communication, incomplete documentation. These can become a major issue. Especially when a parent declines vaccination. So it's important to have those conversations, make sure that they're clear, that they're recorded, that documentation is done properly, so that it doesn't, come back to you. It becomes difficult to show that appropriate education, counseling, and professional judgment was applied when we don't have these items supporting the rationale of negligence. So while professional liability insurance can offer financial protection, it does not replace good clinical practice. Insurance cannot undo preventable harm or repair the loss of trust that may occur when families feel unheard or misinformed. But from my perspective, this really highlights that legal awareness is not about practicing defensively or out of fear. It's more about practicing intentionally. I know that in our book, it's talked about staying aligned with evidence-based standards and being consistent in how care is being delivered, communicated, and documented. So I believe that these awarenesses will only make us better healthcare professionals. By meeting the standard of care and maintaining clear, thorough documentation, healthcare professionals not only reduce legal risks but also strengthen patient relationships and promote safer, more accountable practices. Clear communication helps parents feel supported even when they disagree, and documentation ensures that decisions are transparent and defensible. Understanding professional liability also made me think beyond just legal consequences. While the law clearly outlines what healthcare professionals are required to do, it doesn't always capture the emotional and moral weight of these conversations. I know just sitting across, a provider when I had these questions, I was generally worried about my child and not the legal scenario. But again, as both a healthcare professional and a parent, I've experienced how deeply personal these decisions can feel. That's why it's important to move beyond legal responsibility alone and look at the moral and ethical arguments surrounding childhood vaccination, which is what I'll turn to next. So now that I've discussed the legal responsibilities surrounding childhood vaccination, I want to shift into the moral and ethical arguments. These continue to make this issue more complex. So even when the law is clear and vaccination decisions often involve deeply held values, personal beliefs, and emotional concerns, especially when we involve our children, one of the strongest moral argument is in favor of vaccination policies. It's the responsibility to protect others. This is again that public health perspective that vaccination helps prevent serious illnesses and protect vulnerable populations like infants and immunocompromised individuals. On the other hand, there are ethical arguments against strict vaccination mandates. Many parents believe that they have a moral responsibility to make healthcare decisions for their child based on personal values, religious beliefs, or concerns about safety. So as we deep dive into that moral argument and then I'll transition us to that policy position, I wanted to give a little bit of my perspective where the ethical tension really lives. As a parent, I understand the distinct to want full control over decisions that affect my child's body and health. But at the same time, as a healthcare professional, I also see individual decisions can ripple outward and affect people who have no choice in protecting of their own. So let's deep dive a little bit about what that looks like from those moral arguments, and then we'll show you what policy position looks like when it comes to vaccination in children. So as we're looking at this slide, it really just highlights the core moral tension at the heart of the childhood vaccination debates. So on one side of the arguments is in favor of vaccine requirements, and on the other are the concerns that challenge strict mandates. So if you're looking at your left side, these proponents of vaccination requirements emphasize the moral responsibility to protect vulnerable populations. Again, that includes infants, immunocompromised individuals, and others who cannot be vaccinated and rely on community protection. Those requirements also help prevent outbreaks, especially in schools and shared spaces where diseases can spread quickly. And from the ethical standpoint, this approach is often framed around fairness. Our book talks about the idea of everyone benefiting from reduced diseases risks, and everyone should participate in maintaining that protection. Another source that also alludes to that is the CDC, where they talk about fairness and maintaining protection and gaining that protection by participating in getting the appropriate vaccinations due to your growth, especially when it comes to childhood vaccinations. However, on the right side are the moral concerns. These are raised by those who oppose the strict mandates. A major issue is paternal autonomy. We talked a little bit about this, where the belief that parents should have the primary authority to make healthcare decisions for their children. There are also concerns about trust and resistance, particularly when families feel pressured or unheard, which can lead to increased hesitation rather than cooperation, or in this case, participation as the opposing side. So we did talk about equity and social justice. So this still remains an issue on those that believe that they don't have to get their vaccination because they feel that these mandates affect families who already face barriers to access, potentially leading to unintended consequences like exclusion from education or care. The way I look at it is that this comparison really shows why childhood vaccination is such a complex ethical issue. Both sides are rooted in concern for children and well-being, but they prioritize different values. The ethical challenge is not choosing one side outright, but understanding how to balance protecting vulnerable populations and preventing harm while also respecting parental concerns, building trust, and addressing inequities. This balance is what makes vaccination policy both necessary and ethically challenging. I also think that this is, we spoke earlier about providers being able to be educated enough and to explain the consequences and risk for those who are not vaccinated. So in my opinion, it's that healthcare professionals' time to shine and really just highlighting the benefits and putting to rest the concerns of the risks that the opposing arguments for this moral, ethical discussion of vaccination in children can help. So this slide summarizes my policy position after looking at the ethical, legal, and moral argument surrounding childhood vaccination. At its core, I believe effective public health policy should protect community health while still respecting families. Vaccination requirements play an important part in preventing outbreaks and protecting vulnerable populations, but they should never lose sight of the families they impact. I just believe that policy works best when it's being prioritized through education, access, and trust. Families are far more likely to engage in vaccination decisions when they feel informed and supported rather than pressured. This means providing clear evidence-based information, addressing concerns honestly, and removing barriers such as cost, transportation, or limited access to providers. When education and access are prioritized, vaccines and vaccinations become a shared goal rather than a source of conflict, which also leads me to believe that mandates should be used thoughtfully and proportionally. There are times, especially during outbreaks or when vaccination rates fall dangerously low, that requirements are necessary to protect public health. However, these mandates should be applied carefully and consistently with safeguards in place to avoid unintentionally harming families who already face barriers to care. This is something that the CDC really harps on to make sure that the mandates are applied and that they're consistent. But overall, my policy position supports the vaccination requirements as a public health tool, but only when they're paired with compassion, equity, and clear communication. I think the shared goal isn't just compliance, it's a long-term trust, shared responsibility, and protecting both individual children and the communities that they live in. Huge advocate for my children to get vaccinations, and this is why you see a picture of my daughter Melanie when she was 4 months and she received her dosages. It was a very bittersweet moment. No one wants to hear their child cry, but we as a family prayed on it, and we believe that this was what was important to keep my daughter Melanie safe. Lastly, I wanted to briefly share how biblical values inform my ethical framework in healthcare. While I recognize and respect that not everyone shares the same beliefs as I do, for me, faith doesn't replace ethics or public health principles, but it deepens how I understand responsibility, compassion, and care for others. One verse that captures this balance is Philippians 2:4, which says, "Let each of you look not only to his own interests, but also to the interest of others." This verse reflects the heart of many public health efforts, especially childhood vaccination, where decisions made for one child can impact the health and safety of others in the community. As a healthcare professional and a parent, my perspective has reminded me that ethical decision-making often requires holding both personal responsibility and community responsibility at the same time. It encourages me to keep compassion for families who are navigating through fear or uncertainty, while also reinforcing the importance of protecting vulnerable individuals who rely on collective action for their safety. Ultimately, this verse reinforces my belief that ethical healthcare practices should be grounded in care for others, stewardship, and humility. It aligns closely with public health goals of preventing harm, promoting fairness, and protecting life, while still honoring the dignity and autonomy of each individual. While I was working on this slide, this song came to me that I absolutely adore, and it always puts me in good spirits. It's The Blessing by Elevation Worship Music. It is not part of my presentation, but I did add it because there's a part that starts at minute 4, second 18, and it just talks about the blessings that we want from our Lord. And I think of it as being a blessing to the world for generations and generations. So this song, I hope, speaks to you as it spoke to me while I was doing this presentation. My last slide will be about just a recap and some takeaways from this presentation. I wanted to close this out with final takeaways and closing thoughts. Just kind of a recap of the presentation I used by framing the childhood vaccination. I went over through it, the introduction, some of the issues and why it was important, not just as a medical issue, but as an ethical dilemma that continues to affect families, healthcare professionals, and public health systems. From there, I walked us through the major concepts and controversies that make this topic so complex, including trust, risk, parental responsibility, and community protection. We looked at some ethical theories and principles that help guide making those decisions, followed by the legal framework and standard of care that also dealt with tort claims and liability, the importance of informed consent forms. Also talked about how it shapes the healthcare professionals and are expected to practice in real-world settings. I examined and explored what moral arguments were from both sides and how public health policy attempts to balance individual rights with responsibility to protect the broader community. I shared my personal biblical belief and values that I use for my ethical framework, just emphasizing care for the vulnerable, my stewardship and humility, while still recognizing and respecting that not everyone shares the same beliefs I do. But overall, my takeaway is that childhood vaccination sits at the intersection of ethics, law, public health, and personal values. I don't think there's just one simple answer, but ethical practice does require us to have compassion, accountability, and a commitment to protect both children, the feelings of parents may feel, that parental autonomy, and the communities that we all belong to. Thank you for the time allotted for this presentation.